Showing my ID. My ID.
Hold on. All right, it's recording.
Showing my ID. This is a pediatric lab assessment, nurse 5130-461. Doing a comprehensive head-to-toe assessment of a 25-year-old male. Next, I'm going to scan the room. As you'll notice, we have several cameras. Got one on a tripod, my laptop, a cell phone, because we are having a hard time getting one continuous recording without something stopping. So hopefully we will get one of them to work. So I'm going to scan the room with this camera. This is my assessment table. Here is my blank sheet of paper and the rest of the room. Okay. And then set this one like that. Okay, now I'm gonna do a memory dump. So be careful with that.
Okay.
Okay, I'm gonna do memory dump.
There's a blank sheet of paper and table. Okay.
consent to being filmed and assessed?
I do.
All right, thank you. Well, my name is Alice. I'm going to be your provider today. Can you tell me your name and date of birth?
My name is John, 11/4/93.
All right, thank you. And can you tell me what today's date is?
It is 11/21/18.
Okay, thank you. And do you know where you're located?
Temple, Texas.
All right, great, thank you. So what would you, how would you describe your mood?
I'm doing okay.
Doing good? Okay,
Yeah,
good.
after wrestling some technical difficulties. But
Okay,
yeah,
yeah.
I'm okay now.
Okay, good.
I hope.
So I am testing, assessing for just general appearance and alertness, orientation.
Okay.
I can see that the patient is alert and oriented ×3. General appearance is, you know, well groomed, and mood is congruent with affect. So that's good. So I'm gonna have you sit on this table. Actually, this is for you, and I am gonna. Okay, so cameras are here. Okay, all right. Okay, so I'm going to start by assessing your skin.
Okay.
So just taking a look at the overall skin. It's warm. It's tan in color. I'm not seeing any masses or lesions. I'm gonna go ahead and do some hand hygiene here for a feel on your skin. I'm just gonna note the temperature. It's warm to touch and your skin is dry. So gonna go ahead and take a look at your nail beds. Going back to your skin, I don't notice any tattoos or bruising or any open sores or anything like that. So going to your nails, assessing your nails, looking at the character of your nails, and they are, the nail beds are intact. The shape of your nail bed is about 160-degree angle bilaterally to all fingertips, and the nail beds are pink. No clubbing, cyanosis, or striations noted. So I'm gonna go ahead and test for capillary refill. So testing all your fingernails. They are less than 2 seconds bilaterally, and then I'm gonna go ahead and look at your feet. The toenails, nail beds they look good, they're intact, pink. The angle and shape of your nails are about 160-degree angle bilaterally. Going and feeling for your capillary refill, I can see that they are less than 2 seconds bilaterally. So next I'm gonna go ahead and assess your hair and scalp. So just by looking, I can tell that you have evenly distributed hair, no hair loss from what I can see. The hair feels fine and soft. If I go ahead and feel in your scalp, I'm feeling for any masses or nodules. Do you have any tenderness when I feel?
No.
Okay, so no tenderness noted. I'm looking a little bit deeper in and no infestations noted. And going to your, I guess the hair and scalp portion is done. So next I'm going to go ahead and do an assessment on your head and neck. So I'm going to go ahead and just kind of lightly palpate alongside your face, noting any nodules, any tenderness.
No.
No tenderness. Okay. And just looking at the overall appearance of your head and neck, it appears to be centered, midline, symmetrical facial features. So I'm going to go ahead and feel for your carotid pulse. I'm going to go ahead and feel, palpate that, and I give myself a few seconds. I can assess the rate and rhythm, which is regular, and about 2+ bilaterally, and feeling for your trachea and your thyroid. I'm not feeling any masses or lumps. Go ahead and take a good swallow. All right, did you have any difficulty swallowing?
No.
Okay, no hoarseness in your throat?
No.
And do you feel any pain when I palpate?
No.
Okay, all right. So I'm gonna go ahead and go ahead and start assessing your eyes. So what I'm gonna do is look at the general appearance of your eyes, if you don't mind taking your glasses off. Thank you. All right, so just looking at the eyes, I'm looking for symmetry, any drooping, deviations. I'm not noticing anything. Everything looks pretty symmetrical. Looking at the eyebrows, they're symmetrical, and the eyelashes, they look clean and they're evenly distributed. Next, I'm going to go ahead and take a look at your conjunctiva. Looks good. I'm seeing good vascular landmarks, and conjunctiva is clear. The lens is clear. Your sclera appears white. Your iris is hazel green color. And then I'm going to go ahead and palpate your lacrimal apparatus. And is that tender?
No.
No. Okay. I don't feel any masses or anything like that. I don't see any exudate, redness. Next thing that I'm going to do with your eyes is I'm going to go ahead and test your perla, which is testing for your pupillary. Are they equal in size? Are they round? Do your pupils react to light in accommodation? So I am going to get my ophthalmoscope lights to use because my pen light broke. Okay. Oh, that's not good. There we go. Okay. All right. So I'm going to go ahead and test for your pupil reaction to the light. Now, looking at your pupils are round and equal bilaterally, and I would measure your pupils at 5 millimeters, and then I'm going to go ahead and dim the lights just to get a better idea of your pupils. Okay, there we go. So I'm going to shine the light directly over your left eye, and I'm noticing that it's reacting, it's constricting about 2 millimeters. So that's a direct constriction, and then coming to your to your right eye, I'm going to still assess your left eye's pupil, and it does constrict consensually. Now I'm going to test your right eye's pupil response, and it does react to light. Pupillary response constricts. And then still testing your right eye, your right pupil. As I shine the light, it does constrict consensually. So now I'm going to test for the accommodation. So with that, I'm going to have you, go ahead and put your glasses on and take a look at the tip of my pen, and then look at a distant point behind me, and then take a look again at the tip of my pen, and do it again, and then here. I'm testing for your pupils if they constrict, which they do, which tells me that your eyes, your pupils react to accommodation. So that is the pearl part. Then I want to talk about different eye exams that are available for testing acuity, and that's going to be the Snellen eye chart. That one is a visual acuity test, and it is done by having the patient stand at a certain distance away from the eye chart, and then beginning at the 20/40 line and going up if they can, if not going down, testing both eyes, and then covering the right eye, testing the left, and then covering the left, testing the right. If the patient wears glasses or contacts, then they do need to wear those during the visual acuity test. Another type of visual acuity test is the Allen's card, and that is a test that is given typically to children between the ages of 2 to 4 who are not able to identify numbers or letters. So it's pictures that are shown to the child up close, and then the picture is taken far away from a distance of about 15 feet, and the child has to get a certain number correct to pass the test. So they're given 3 out of 7. If they get 3 out of 7 cards correct, then that's a passing score, and they do have up to 5 attempts. So those are the 2 different kinds of acuity tests. So next I am going to test for corneal light reflex. So I'll have you take off your glasses again. Thank you. So what this tests for is whenever I shine the light, if I see the light reflect in your pupils at the same spot on both pupils, that means that you don't have any deviations, or there's no strabismus noted. So I'm going to go ahead and do that. And I do see that the reflection of my light shines in the same spot on both of your pupils. So no strabismus noted. The next test that I'm going to do on you is the cover-uncover test. So I'm going to go ahead and have you take this card, and I want you to cover your left eye, and I want you to look at me and then uncover your eye. Okay, I'm looking for any deviations or unnatural movement to the tested eye. So I want you to take the card and cover your right eye and do the same, where you uncover it looking at me. And I did not see his left eye move or deviate or anything like that. So that tests for strabismus as well. So no strabismus noted. The next test I'm going to test you for is the 6 cardinal points. So you're going to go ahead and follow my pen, and just don't, without moving your head, you're going to follow my pen. There we go. And I'm looking for any wiggling or deviation that would indicate nystagmus, which I did not see, so no nystagmus noted. Then one of the next eye tests that I'm going to do on you is the red reflex, and then I'm going to go ahead and look inside your eye. So from a distance, so that this camera sees me, you can kind of turn a little bit that way. Thank you. I'm going to stand from a distance. I'm going to take off my glasses too, because I need to focus at a point here. Okay, so I'm going to look at your right eye with my right eye as I come in. Okay, so focusing, and if you can open your eyes, there you go. I see the red reflex, and looking deep in, I'm looking at your optic disc, and it is intact. The retina is red, and no hemorrhages are noted. Thank you. Okay, so looking at your left eye, I'm going to do the same thing, and I'm going to focus, and I'm going to come in, and I notice the red reflex, and looking inside your eye, I do note the optic disc is intact, the retina is red, and no hemorrhages are noted. So thank you. All right. So in terms of testing those different eye exams, it also tests for the cranial nerves 2, 3, 4, and 6. 2 is the Snellen, which we talked about, we didn't do. 3, 4, and 6 are going to be the 6 cardinal fields, uncover test, and the corneal light reflex. So next I'm going to turn the lights back on, and we're going to go ahead and move on to the nose. So just looking at the appearance of your nose, I'm looking for symmetry, any masses or lesions. I don't note any of those. Your bridge of your nose appears midline. So what I'm going to do is I'm going to check for patency of your nares. I'm going to occlude your right nair, and I'm going to have you breathe in through your nose. Okay, that is patent. Good. I'm going to occlude your left nair, and I'm going to have you do the same thing. And it sounds patent, so that's good. And now I'm going to take a look inside. So I'm going to turn my light back on. Okay, so I'll have you tilt your head back, and I'm just going to check. I'm going to brace here with my hand, and I'm going to take a look. I'm looking at your septum, which is not deviated, no bleeding noted, no edema or exudate or drainage or anything like that. And looking at the left, I'll go ahead and brace here. Septum is intact, no deviations. Septum is midline, no bleeding, and no swelling, no drainage, and so that looks good. Thank you. All right, on to your mouth and throat. So before I use my light to look inside, I'm going to feel around on your mouth and stuff. So I am going to put some gloves on. So looking at your lips, I'm noticing, I'm looking for symmetry, color, texture, any abnormalities. I don't notice any lesions or masses. It's symmetrical. Lips are pink and moist. So I'm going to just feel around on your lips, and then go inside. I'm looking at your gums. Gums are pink and moist, and your buccal mucosa is also pink and moist. No lesions, no masses. If I were to count your teeth, I am counting 32 pearly white teeth. Go ahead and stick out your tongue. Your tongue is dull, red, moist, midline. Go ahead and move it from side to side, even movements, no deviations noted. All right, so now I'm gonna take a look inside your mouth with my light. I'm gonna take a look here. Go ahead and open, stick out your tongues, say ah. Okay. Oh, I noticed that your uvula is midline and moves when you say ah. Okay. I'm looking at the back of your pharynx. I'm noticing, what I look for is mucosa, which is pink, no redness, no lesions, and I'm looking at your tonsils, which are not enlarged, they're not swollen. And if I were to give the size of your tonsils, I would say that they were 1+ bilaterally. So that's it for that. Thank you. Next, I'm going to listen to or assess your ears. So I'm gonna go ahead and switch out to my otoscope, and looking at the outside of your ears, they appear symmetrical, in line with your eyes, and I'm gonna palpate your pinna. Is that tender?
Not at all.
Okay, and I'm also palpating around near the masseter. Is that tender?
No.
Okay. I do note a piercing on the upper left lobe, but no masses, no lesions or anything like that. Is it tender?
No.
Okay. All right. So now I'm gonna visualize the inside of your ear canal. My light. All right. So I'm gonna pull your pinna up and back. So bracing my hand on your forehead, pulling your earlobe up and back. I'm gonna take a look in, and I'm looking for any redness, lesions, foreign bodies, which I don't note in any of that. No drainage. There is a mild amount of cerumen, which is normal. And then your eardrum, it is pearly white, the visible bony landmarks, no perforations, and let me check for the light reflex against the tympanic membrane. On the right ear, I do see a light at the 5 o'clock. All right, thank you. Now I'm going to test your left ear. So I'm going to come in, pull your pinna up and back, and then I'm going to brace with my left hand on your ear. Looking at your ear canal, I'm looking for any redness, drainage, lesions, foreign bodies, which I don't note any of that. There is a mild amount of cerumen, which is normal. And then looking at your tympanic membrane, it is pearly gray in color, visible bony landmarks, no perforations, and with the left ear, I do see the light shining at the 7 o'clock. All right, thank you. Okay, so next I'm going to palpate your lymph nodes. So I'm going to start at the occipital. Is that tender?
No.
The post-auricular, tenderness?
No.
Pre-auricular?
No.
No tenderness. Then the mandibular?
No.
Submandibular?
No.
Submental?
No.
Anterior cervical? No tenderness noted?
No.
Posterior cervical?
No.
So supraclavicular?
Nope.
No tenderness bilaterally. Axillary? And can't remember the name of this one. But I'm palpating for tenderness. No tenderness? Nope. Okay, so no tenderness to bilateral lymph nodes. All right. Next we are going to be doing a lung and chest assessment. So I'm going to have you take off your shirt. Thank you. Just looking at general appearance of your chest, I'm noticing even shoulders bilaterally, good posture, breath sounds are unlabored. We've got a piercing at the left nipple. Some chest hair is noted. The skin color is tan. No lesions noted, no open wounds or tattoos. And so what I'm going to do is I am going to I'm going to percuss your lung fields. I'm going to start with your back. I'm going to have you actually turn so that the camera can see me percuss. All right, thank you. Okay. In between intercostal spaces. If you can lean forward with your arms in front, thank you. I'm listening for resonance, and I'm gonna go ahead and have you turn back around. I'm gonna test for the lateral and anterior portion. So if you can bring your arms up. Okay, here we go. In between the intercostal spaces. All right, so all percussion has resonant sound. So next I'm going to listen to your lung fields. I'm going to start with your back.
You can turn.
Yeah, if you don't mind. I'm going to listen with the diaphragm of my stethoscope, which is going to have a better sound over the lung fields. So if you don't mind taking a deep breath in. turn back around. Okay. Okay, so what I hear over the upper portion, I'm hearing brachial or bronchial breath sounds, and then the sound was expiratory was greater than inspiratory. And then over the second intercostal spaces at the midclavicular line, I'm hearing bronchiovesicular breath sounds. Inspiratory equals expiratory. And then over the peripheral lung fields, I'm hearing vesicular breath sounds where inspiratory is greater than expiratory. So that is my findings bilaterally for all those lung fields. And I am also going to, I did not palpate with your neck. When I was doing your neck, I did not palpate for thyroid I noted thyromegaly, but I didn't listen to your trachea or your carotid pulse. So I'm going to do that even though it's out of order, real quick, okay? So I'm gonna palpate for your carotid, and then I'm gonna feel for it. I'm gonna auscultate it with the bell of my stethoscope. No bruise. And then I'm going to listen to your trachea. You could take a deep breath in. Yes, good. So definitely bronchial breath sounds heard over that. So that's good. Okay, so next I am going to assess your heart. So there are 3 different positions that are best when assessing the heart, and that's going to be sitting upright, slightly leaning forward, supine, or left lying recumbent. Now, whenever you're going to use the diaphragm of your stethoscope, it is best to be sitting upright, slightly forward. So I'm going to assess your heart's sounds in that position, and then I'll go ahead and have you lie left lying recumbent, and I'll listen with the bell of my stethoscope. Okay, so I'm just gonna sit next to you here. Going over the aortic at the second intercostal space, right sternal border. Listening, hearing S2 is greater than S1. Now I'm listening to the pulmonic heart sound at the second intercostal space, left sternal border, where S2 is greater than S1. And then Erb's point, just the third intercostal space, left sternal border, where S1 and equals S2. And then the tricuspid is the fourth intercostal space, left sternal border, where S1 is greater than S2. If you could lead slightly forward, listening to the apical that is at the 5th intercostal space at the mid-clavicular line, or the forget the point, the line, but it's S1 is greater than S2, and gonna palpate your apical pulse in the precordium, which is at the point of maximal impulse. If I take a moment to palpate your pulse, I can note the rate and rhythm, which is regular, and the rate is going to be 70 beats per minute. No gallops, murmurs, or anything was auscultated or felt or palpated. Okay, so I'll have you lay left lying recumbent, and I will listen with the bell of my stethoscope. Left, yeah, left. Okay. Okay, same thing. Aortic, second intercostal space, right sternal border. S2 is greater than S1. Pulmonic, second intercostal space, left sternal border, S2 greater than S1. Erb's point, third intercostal space, left sternal border, S1 is equal to S2. Tricuspid is fourth intercostal space, left sternal border, S1 is greater than S2. And the apical is going to be the fifth intercostal space at the, where S1 is greater than S2. Okay, thank you. Okay. Next, we're going to be assessing for your pulses. So I'm going to feel for your temporal pulses bilaterally, 2 plus felt bilaterally. Next, your carotid. I think I did those already, 2 plus bilaterally. And your brachial. Two plus bilaterally. Your radial, 2 plus bilaterally. Your posterior tibialis. I don't know if the camera is getting that. Okay.
The laptop one is.
2 plus bilaterally, and then your dorsalis pedis. Palpating 2 plus bilaterally. All right, thank you. Okay, now I'm going to assess your abdomen. So just looking at the overall appearance of your abdomen, I'm noting your skin color is tan. It's symmetrical. If you can lay down, I'm going to look at the contouring of your stomach. It's contoured. There isn't any peristaltic movement, no unevenness noted, no masses noted. So let's see, what am I going to do next? Visualize. I'm going to percuss over your. Well, I'm gonna auscultate your vowel sounds in the quadrants. So I'm gonna listen to all 4 quadrants with the diaphragm of my stethoscope. I'm going to start at the right upper quadrant. Left upper quadrant. Left lower quadrant. Right lower quadrant. Epigastric area. And I'm hearing vowel sounds in all 4 quadrants, including the epigastric area. Next, I'm gonna percuss your stomach. So I'm hearing tympani, which is a common sound that is percussed over the abdominal area because there's a lot of gas in the stomach and the intestines. Occasionally you'll percuss dullness if that's over an organ or a mass. So I'm going to auscultate your liver next. In order to find that, I'm going to start at the mid-clavicular line low in the abdominal area where I'm hearing tympani. And then whenever I hear dullness, I'm going to take a pen and mark where I hear dullness. And then going to start from the top at the mid-clavicular line, and where I hear resonance and then dullness, I'm going to go ahead and mark with my pen where that change is made. Now I'm going to measure this vertical liver span to see how the liver, what that measures. So I am getting a 7, which falls within the range of between 6 and 12 centimeters. So I got 7 centimeters. So that's good. Next I'm going to percuss the spleen. So I'm going to be checking several different areas over on the left mid axillary line, the mid-axillary line, and I am hearing dullness over between intercostal space 6 through 10. And next I'm going to palpate the stomach. So palpating, I'm going to do a light palpation with my hands in each quadrant. I'm feeling for any masses, tenderness. Is it tender?
No, not at all.
Any abnormalities or unsymmetrical findings. Then I'm going to go ahead and palpate deeper. Going to kind of spread my hands and palm more, and I'm going to press in, and I am noting, assessing for any tenderness or masses, which I do not feel in any quadrants. Okay, so next I'm going to palpate the liver. So I'm going to put my left hand under the back by the 10th and 11th ribs. I'm going to push my left hand up to raise the liver up as well, and then I'm going to press my hand down underneath the liver margin. And as I press in, I'm gonna press in, down, and up. And is there any tenderness with that? I'm not palpating the liver, which I think is a normal finding. So no hepatomegaly, no tenderness or masses noted. I am gonna do another test to test your gallbladder, and that is called the Murphy's test. So what I'm gonna do is I'm going to locate the lower liver margin next to the abductus recti muscle, and I'm gonna press down and up. I'm gonna have you take a deep breath in, and then I'm gonna press in as you exhale out. Does that hurt? No. Okay, so the Murphy's test is negative. All right, thank you. So I think that is it for the abdomen. And next we're gonna assess the musculoskeletal system.
Are you dressed?
Yes, yes, musculoskeletal. So actually, now that you're standing, what I'll do is I will assess your gait and check for evenness. So if I can have you walk straight to the door, I'm gonna look at your gait. I'm gonna notice your shoulders are set evenly and symmetrical. Okay, you can go ahead and have a seat. Thank you. And next I'm going to check for scoliosis, actually. So if you could stand and then bend over and reach for your toes. That's good, yeah. And then I'm going to be looking at the curvature of your spine. If you can go ahead and then raise back up to normal position. Looking at the curvature of your spine. There were no deviations to that, so no scoliosis is detected. Okay, thank you. So now I'm going to test your reflexes. Not your reflexes, your range of motion.
Okay.
Go ahead and start by bringing your chin to your chest, and then all the way back up. Yeah, and then back to normal position. And then go ahead and bring your ear to your shoulder without bringing your shoulder up on the left, and then repeat to the right. And then go ahead and look to your left as far as you can, okay? And then look to your right as far as you can. So range of motion of your cervical spine seems to be full range of motion bilaterally. And next I'm going to assess your range of motion of your elbows. So if you can flex at your elbow, flex and then extend, okay? Full range of motion is noted with that. If you can go ahead and keep your arms out, I'm gonna have you flex your fingers down, okay? I'm seeing 90-degree angle with that, and then go ahead and hyperflex your fingers up. Looks like about a 30-degree angle with that. And then go ahead and touch your thumb to all your fingers, testing for finger and grip strength. And go ahead and make a fist. Okay, good. And then go ahead and open all your fingers, adduction, and then closing them at abduction and adduction. And go ahead and drop your wrist down, flexing your wrist. Looks like a good 90-degree angle. And then extend up. Looks like about 70 degrees. So full range of motion on that. And then go ahead and bring your palms up. So you're going to supinate and then bring them down. You're going to pronate. And full range of motion is noted to your elbows, wrists, and fingers. Next, I'm gonna assess your shoulder range of motion. So I'm gonna have you bring your arms forward and all the way up to your ears. And noting 180-degree range of motion, full range of motion, bring them down. And then go all the way back, as far back as you can, hyper flexing. It looks like about 50-degree angle, which is good. And then go ahead and bring your arms out to your side laterally, all the way up to your ears. Noting 180-degree full range of motion with those shoulders. And next I'm going to assess your hips, knees, ankles, and toes. So with your hips, I'm gonna have you lay back down and keep, with this leg straight, I'm gonna have you bring your leg up and keep it straight. All right, almost about 90 degrees. So I would say about 75 or 80, which is good. And then go ahead and repeat, or do the opposite leg. Keep it straight, and then good. Not quite 90 degrees, but almost, so that's good. Good range of motion to those hips. Now I want you to go ahead and swing your left leg out, keeping it straight, testing for abduction. And that is about 40-degree range of motion. Yeah, and then go ahead and do the right, about 45-degree range of motion. Good. So with that, the hips. Okay, and then with this leg straight, bend your right knee up to your stomach. Okay, that's good. That's about a 150-degree angle. And then do the other leg while keeping your right leg straight. Okay, good. It's about 100, I think that it's 120. Yeah, not 150. So that's good. Next, I'm gonna test your range of motion in your knees. So I'll have you stand. And then go ahead and bend your right knee. Okay, good. That's bend your left knee. And I would say that's about 120-degree range of motion. So good range of motion on your bilateral knees. And then we'll test your ankles and your toes. So if you have a seat, go ahead and flex, or you're gonna dorsiflex your feet up, your toes up. And that is about a 20-degree angle, and then plantar flex your feet. So that's good. That's about 30-40 degrees range of motion. And then if you bring the soles of your feet in, you're gonna inversion, which is about 30-40 degrees. And then if you bring the soles of your feet out away from each other, that's eversion. That's about a 20-degree angle range of motion, which is good, normal, expected findings for these range of motions bilaterally. Go ahead and flex your toes and then straighten them out. Okay, good range of motion of your toes bilaterally. So all range of motion within normal limits bilaterally, no deficits noted, and I am going to test for an extra, I'm going to do a little extra test for balance. So I'll have you stand with your arms straight by your side and your feet closed all the way. I'm going to test your balance, and if you close your eyes, I want to watch and see what happens. Slight swaying is can be expected, but if they're just completely falling out, that would be a positive Romberg sign, which, and you can sit back down. A positive Romberg sign can be indicative of vestibulo dysfunction, sensory loss, but your Romberg was negative, so that's good. And now we're going to go to the cranial nerves. So I'm not going to test the olfactory. We're not going to test it, but I'm just going to verbalize it. Olfactory is cranial nerve 1, which is sensory function for different smells. The optic nerve is cranial nerve 2, which is another sensory. A way to test it is through visual acuity, which we have talked about earlier. And the oculomotor nerve is the cranial nerve number 3. And we did test that earlier with the 6 cardinal fields and the cover-uncover test and the corneal light reflex. The trochlear is cranial nerve number 4, and that one is also the movement, test for movement, and we did that with the 6 cardinal fields test, the cover-uncover test, and the corneal light reflex. And the trigeminal is the 5th cranial nerve, and that one is a sensory and a motor test for both of those things. The way we test for the motor part is I am going to feel for your masseter. If you can kind of, clenching your jaw, I'm feeling your masseter muscles, which are intact bilaterally. And the abducens is cranial nerve number 6. That also tests for motor function, which we already did with the 6 cardinal fields, cover-uncover test, and the corneal light reflex. The facial nerve is cranial nerve number 7, and it has a sensory and a motor component to it. The motor component will test for things like smile, frown, raise your eyebrows, squint your eyes shut. I'm looking for symmetry and any deviations noted. I don't note anything. Everything looks normal. To test the sensory part of the facial nerve, cranial nerve, we are going to do a taste test to test if you can determine sugar or salt on the 2/3 part of your tongue. So I have that here. Okay, if you could just close your eyes and tell me what this taste is.
Oh, the salt.
Good, good. Okay, next.
Like sugar.
Sugar, yes, correct. Good job, thank you. Now we're gonna, the auditory is cranial nerve number 8, and that tests for sensory. That's that done by the whisper test, which we did. Did we do the whisper test?
Yeah, you said apple pie.
Okay, we've done this so many times today, I'm forgetting which one. Okay, so we already did that. And glossopharyngeal is cranial nerve number 9, and that sensory and a motor component to it as well. One way to test for the motor function of your glossopharyngeal is to do the swallow test, which we've done already when we assessed your neck and your trachea and all that. The sensory, to test for that function, we will test for sour and bitter. Okay, so if you can close your eyes. Tell me what this taste is. The 2/3, sorry, the 2/3 area of your
That's sour.
It's sour, good, okay. All right, keep your eyes closed. Tell me if you stick your tongue out a little bit. The 1/3 portion of the tongue.
That's better.
Bitter, okay, good. Correct, you are correct. Okay. Now, cranial nerves 10 and 11 are going to be cranial nerve 10 is the vagus nerve, and that also tests for the same as the glossopharyngeal. The spinal nerves is cranial nerve 11. We did, you know what, I don't think I tested for that, where I will have you shrug your shoulders, and go ahead and shrug your shoulders, and shrug your shoulders, keep them shrugged, and I am going to press down. All right, so pressing down, I'm testing the trapezius muscles, and they are good and intact. So that is testing cranial nerve number 11. And then the hypoglossal is cranial nerve number 12. That is has a motor aspect to it, and all that is sticking out your tongue, which we did. We did that already, so sticking out your tongue. Now I'm going to test for coordination. So if you can get your finger, touch your nose with your right finger, touch your nose with your left finger, okay? And then go ahead and pat your legs with your hands, and then alternating from up, palm, down. Yes, good. Coordination is intact. I'm going to test your sensations next. So going to be doing, oh, you know what? That is what the trigeminal nerve also tests for, sensation to the face. But we're going to do a full head and arms and legs. So what I'm going to do is, I've got some stuff here. I'm either going to prick you with a sharp object, a dull object, or something like this, soft. Okay, so I want you to close your eyes, and then I want you to tell me where I'm touching you and what kind of sensation you're feeling. Okay, here we go.
Right arm feels sharp.
Correct.
Left cheek, it's the cotton.
Correct.
Right leg, a dull object.
Okay, good. That's good enough. Thank you. That was correct. So sensations all intact bilaterally, and I think that was it for sensations. Then I'm going to test your deep tendon reflexes. So we're going to start with your biceps. So here, I think I can use this here. Here we go, yeah. Okay, about a 2+ reflex. Okay, and then I'm going to test the triceps. Okay, about a 2+ reflex. Now I'm going to test your left biceps. Okay, about a 2+, and then your triceps. Okay, about a 2+. And then I'm gonna test your brachial radial reflex. Okay, 2+, and then the left. Okay, 2+. Now I'm gonna test your patellar reflexes. Okay. Go ahead and try to relax that leg. Okay, good. That was a 2+ reaction, reflex. Now I'm gonna test your Achilles. So if you can, just kind of lean on the table like that and hang your foot. Okay. All right, 2+ reaction, 2+ reflex. Good job. So reflex is all intact bilaterally. Now, lastly, I'm going to have you lay down, and I'm going to test for a Babinski reflex, which you should not have anymore. You only have that when you're a baby. But what I look for is fanning out of the toes. I do not see any Babinski reflex. That would indicate some kind of nerve abnormality. So that is it. That concludes my comprehensive head-to-toe assessment. Thank you so much.
Thank you.
Oh, I went over. It's over an hour. Dang.
Well, you're supposed to be just an
No,
Oh.
we can crop out the beginning.